أنا باسم الشافي أرقيك من كل سقام يؤذيك، بيميني أمسح ما تشكو وبعمر الباقي أفديك، وأتمتم دمعا ودعاء يرعاك الله ويشفيك، وأتمتم دمعا ودعاء يرعاك الله ويشفيك. لا بأس.
بسم الله الرحمن الرحيم. إن الحمد لله نحمده ونشكره ونستغفره ونعوذ بالله من شرور أنفسنا ومن سيئات أعمالنا، من يهده الله فلا مضل له ومن يضلل فلا هادي له، نشهد أن لا إله إلا الله وحده لا شريك له ونشهد أن محمدا عبده ورسوله. Viewers at home, you are most welcome to today's program on Ummatan Wasatan TV. This special TV program is aimed at leading human beings to salvation. In today's segment of the program, we will be talking on earth matters. Earth matters that are related to our earth. You know, there's a public saying that health is wealth. That is, those who have good health are the ones that will be responsible to the family, to the community, and to the world at large. So we need to jealously guard our health. As we know, we have those that are living with some health challenges one way or the other. Therefore, we need to look at some of these health challenges. What are the way out of those challenges? And even those of us that sometimes we do not have them, we do not have those challenges, how are we not going to run into those trouble? Because sometimes it is just the lack of knowledge that will cause some of these health problems. So in our programs, sometimes we might require even the change in lifestyles. So we'll be inviting different experts to discuss for us some of those health challenges and how we can solve those health challenges. If you look at the Quran says, وَأَنْفِقُوا مِمَّا رَزَقْنَاكُمْ وَلَا تُلْقُوا بِأَيْدِيكُمْ إِلَى التَّهْلُكَةِ. Surah Al-Baqarah, verse 195. Allah says, spend from whatever Allah has given you, but do not throw yourself into difficulties. This simple ayah can be interpreted to mean that you should not put yourself into, Allah that has given you good health, you should not put yourself into things that will make you to lose good health that you have been bestowed with. Good health is a special blessing from Allah. And even the Prophet ﷺ said, that we should make use of 5 things before 5 things overtake it. One of it, because of time, is sihataka qabla sakomik, that we should take good care of our health, our health before we become ill. So having good health is something that we should guard jealously, and those that are living with one health challenge or the other needs to be advised, needs to know where to look for solutions to their problem. And so this very important program will be looking into different health challenges and how to get out of the trouble. Today we'll be talking, our topic will be tuberculosis. We somehow take tuberculosis maybe because this month, I guess March 24, is going to be the World Tuberculosis Day, and so I think it's accurate to start with that, especially going by the very difficult situation that is to put those ones that are suffering from such disease. So today will be tuberculosis. I have in the studio with me today a very important medical health physician. He's a public health physician. In fact, he's a program manager of Kwara State Tuberculosis, Leprosy and Borreliosis Kwara Control Program in Kwara State. I have with me in the studio Dr. Fatima Lawala. Dr. Fatima, please your testimony to the audience, to our viewers.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh. Here is Dr. Fatima Lawala. He will be speaking to us on tuberculosis. Dr. Fatima, what is tuberculosis? Let's start from that.
Okay, thank you very much for that question. Tuberculosis is a bacterial infection that is caused by Mycobacterium tuberculosis complex. They are a group of organisms that causes tuberculosis. And there are different forms of tuberculosis, of course, depending on where it is affected in the body system. But the commonest is pulmonary tuberculosis, when it affects the lungs, which is the common one that everyone says. But the other one is the extrapulmonary tuberculosis with ETB, when it affects any other part of the body.
So it depends, it depends on the part of the body that is affected that will determine the names that will be given to it, or
yes,
what?
Yes.
Okay. So we have different kind of tuberculosis, and the area that is affected will determine the kind of treatment even that's going to be given. Okay. Dr. Fatima, what are the primary modes of transmission for tuberculosis? Primary mode of transmission of tuberculosis.
The primary mode of transmission of tuberculosis is through airborne, meaning that when somebody that is infected, that has active infection, coughs or sneeze or talk, while talking spit out saliva, and the other uninfected person picks up this saliva and in a way inhale it into his lungs, his or her lungs, then the person can get infection through that. Yes.
Okay.
So it's primarily through.
So it's airborne. It's airborne disease. So it's airborne disease. Okay. So which means could you please discuss the current global impact of tuberculosis, including the prevalence rates and the affected regions mostly in the world?
All right. Thank you very much. On a global scale, over 2 billion people have been infected.
2 billion.
Yes. Well, that doesn't translate to active infection. A lot of people have developed infection due to tuberculosis in the past, but fortunately or unfortunately, it did not come down with active infection. We call it latent infection, when somebody is infected and is not symptomatic. In this situation, the person is not infectious, is not able to transmit it to other people. So we have quite a large number of people being infected in the past globally. However, when you come to Africa, as part of low and middle income countries that are affected, Nigeria is one out of the 30 countries all over the world that still have high burden of this infection in the world.
Okay.
Yes.
Okay.
So concerning the prevalence and the incidence rate, the incidence of tuberculosis for the countries that still have the high burden, where it is still a global, where it's still a threat to public health, we have as much as 209 persons in 100,000 of population having TB. However, the prevalence is still difficult to ascertain in our region because of a large gap in case notification. We have a lot of missed cases in the community. A lot of people are misdiagnosed. Some people are assuming they have other disease, whereas it's TB, so they are treated for something else. A lot of deaths that are supposed to be preventable that are caused by TB, but because they did not get to the health facility where diagnosis can be made and necessary treatment given to them, they die. And it's quite unfortunate.
Doctor, please, you mentioned something. You said despite the very difficult position that it puts those that are living with tuberculosis. There are some of them that are asymptomatic. That is, the symptoms will not be shown. How are they going to, be prevented from, others not contacted from them?
Okay, thank you. Just like I said, when it is a latent infection, which I said over 2 billion people, it's a very large whole number. So when I say that, it means that these people, they are just infected, but they did not develop active tuberculosis infection.
Yeah.
It just means that at a point in their life, they have ingested the organism causing TB, so they are infected, but they did not come down with symptoms. And I said that even though they are infected, they are in a latent period, they are asymptomatic, and they are not able to transmit the infection to other people because the organism is in latent phase. Latent means inactive state. So it's when you have active tuberculosis that it can be transmitted from one person to the other.
Okay. Thank you so much. In Nigeria, for instance, do you have the summary of the number of people that are affected in terms of those that are reported cases?
Okay, for now, the statistics for the country for 2023, at least over 700 cases were notified in 2023 in confirmed tuberculosis, and this is still a tip of the iceberg. If you consider what 219 in 100,000 population means to the estimated population of the country, you know that we have still not vested all the cases of TB in the nooks and crannies of the country, and that is what the country is aiming at doing.
Think you so much, Doctor. But please, now I want to ask, what are the symptoms of TB? For TB, I think there should be, so that if I have it, I should be able to know these are things I will notice as a layman.
Thank you very much. For the symptoms of tuberculosis, we will call some symptoms cardinal symptoms. Like you always say, and there are constitutional symptoms as well. For the cardinal symptoms, they are, a patient or somebody who have cough of 2 or more weeks duration. It won't be less than 2 weeks to consider it a presumptive TB case. So it will be more than 2 weeks. Then there will be fever, there will be tiredness, there will be coughing out of sputum. Even though most of these symptoms are not like all these symptoms will be in one person, there are sometimes that it's only one symptom out of all this that I've mentioned that a patient will present with. And you still have to screen and get the necessary tests done to be sure that it's a TB case or not. So weight loss is one of the cardinal symptoms as well. Yes. So and weight loss can happen in any other disease as well. So when someone comes with weight loss of 3 months or more duration, then you should be highly suspicious of TB and screen for TB in that patient. So, and we also have general tiredness during drenching nights. Well, the person sweats excessively. This, everybody sweats, but the kind of sweat that a TB patient will have is like a drenching night sweat. Like the whole clothes will be soiled in the sweat. It will be excessive sweat. And general tiredness, fever, and all other symptoms that can mimic other conditions as well. So we need to probe very well to rule out TB in such cases, or rule in TB as the case may be.
Okay, so which means some of these symptoms is not only related to TB alone. So they might be. That's why sometimes they will be mistold. That some people will just be treating something else.
Exactly.
Okay, as you mentioned in the beginning. Okay. Please, Ma, what are the risk factors for the TB infection?
Okay, there are several risk factors for tuberculosis, but the major risk factors are when there is a contact with someone that is infected. The person have higher risk of getting infection. Then when there is malnourishment, malnourishment puts an individual into a situation of immunosuppression, and anything that leads to immunosuppression puts an individual to higher risk of developing tuberculosis. You know, I talked about latent TB.
Yeah.
When you have a strong immune system, anyone can get TB through close contact with an infected person, but it takes your body system's response to determine if you come down with the disease. And that's why we talk about latent infection and active infection. So when the immune system is compromised due to several diseases, hypertension, diabetes can lead to immunosuppression. When you are on certain medications that are steroid in nature, it can lead to immunosuppression. HIV patients, people living with HIV, they have higher risk of developing TB, and that is why
because their immunes are very low.
So that's why we always screen for TB in HIV patients. It's a good standard. We also screen for HIV in TB patients because they go hand in hand in most cases.
So some of those things are interrelated in terms of the symptoms. Okay.
Yes. And people that live in very crowded environment, you know, ventilation is very key in prevention. So when people are crowded together and someone has the infection, the probability of the other person in that very close space of developing TB is quite high.
Okay, so living in a crowded area can lead to such things. I mean, one can contact it through those others. So we should be living we should look for a ventilated area.
Exactly.
Okay. In Kwara State specifically, and even Nigeria as a whole, where can patient care have the care? When we talk about getting the necessary care that is required as far as the TB is concerned in Kwara State specifically and in Nigeria as a whole.
Well, thank you very much. Let me first put it forward that TB treatment, management generally from diagnosis to treatment is free, completely free. So you can access treatment from any public or private facility.
Okay.
Even though it's not all private facility that provide service for tuberculosis, but almost all of them will screen and link to care. They have been sensitized on screening. When they screen, there is a network of personnel that they will contact. This is a presumptive case. They take sample. There's a way to send it to the diagnostic center. When it comes out for positive, they are designated dot center in both public and private facility. And that is not implying Kwara alone, it's across the 36 states and FCT in Nigeria. So there is free access to diagnosis, free access to treatment across all the local government, across all its facility in the country. Yes.
Thank you so much. But sometimes, how do we get our people sensitized for these things? Because we have some people, they will have some of the symptoms you've mentioned, but some of these health facilities that are available that is not free, they are not aware of it. How are we going to get our people sensitized for this?
Okay, I agree with you that there's a gap in information, and where as a government, the state ministry of it, and even at the country level, there is increase in sensitization, and in fact there's a thematic area now that is being strengthened to ensure that people at the grassroots level, the last mile people, get sensitized about where to seek help, the symptoms they will notice, and where to go through our ACSM component, which is the advocacy, communication and social mobilization component of the control program. And you see us going to, just like we have come here, we go to other radio stations, we provide posters to health facilities. We have at the health facility, we have community mobilizer that also goes to the community, but we know that they still need to strengthen them more to get to all the nooks and crannies in order to sensitize our people about the available services.
Primarily, this program is aimed at making people be aware of some of these things, and now that you know things are more easier now, you don't have to sit before the TV set before this information is getting to you. So all over the social media now, some of this information you are giving us now, inshallah, will get it across to them. And some of the effort of the Kwara State government and Nigeria as a whole, I think, will be something. But Ma, what are the steps in diagnosis and treatment of TB.
Okay. So when someone falls into the category of a presumptive case, a presumptive case means a case that fits in the case definition. I've said something about the symptoms that will make a clinician or a health worker be suspicious of, okay, this is likely a TB case. If that person is having 2 or more weeks of cough, having fever, weight loss, producing blood stains, sputum, and all of that. So you categorize such a patient as a presumptive, and it is expected that even if the patient is in the community, we encourage such patients to present at the health facility so that there will be sample collection. We usually collect sputum sample for adults, or in children, we use stool and some other samples to get the diagnosis, and even chest X-ray as well. So when this test gets to the laboratory, we have our gene expert site. The gene expert is like the major diagnostics tool that we use. It uses PCR technology, and when it is positive like that, the patient is first cancelled even before the sample is collected for possible outcome. So when the outcome comes and it becomes positive, the patient is cancelled again on compliance, because TB medication you have to use it for a certain period of time, and we don't want non-adherence. So we need to cancel again at the point of enrollment for treatment, and the patient is placed on medication and being followed up at a certain period, 2 months, 5 months, till the completion of the medication at 6 months, and the patient is declared cured or completed treatment as the case may be.
So do you mean within the range of 6 months the patient will be completely cured?
Definitely. If, so far as the patient is compliant with medication, yes.
But sometimes we do see, especially when we visit hospitals, we do see some of the patients developing other complications outside the TB disease that was started with. Some of them led to even paralysis. Sometimes I don't know what is the relation between some of these complications and the TB case.
Okay, so just like I said earlier, from my explanation of the different parts of the body that tuberculosis can occur, I said we have pulmonary and extrapulmonary tuberculosis. All right. Paralysis can result if the affected part of the body is the spine. We have spine tuberculosis that affects the spinal cord. So that can lead to one of the complications. Paralysis can, and it might not even be like spine TB. Sometimes people have comorbidities. They are dealing with some other things apart from tuberculosis, and those complications might not be primarily from tuberculosis, might be from the other comorbid condition that they have. But it's possible that someone that has TB, especially when they don't present early, when you present early, the treatment's outcome, the possibility of having a complete cure is higher. But when you present late, there are already complications from systemic failure, then chances of survival become slow, and that is why we are advocating that people present early to the hospital and get this treatment, which is absolutely free.
Thank you so much, doctor. But for how expensive is some of this management of TB?
Okay, just like I keep emphasizing, the management of TB is absolutely free. From diagnosis is at zero cost to the patient, to the treatment is at zero cost to the patient. In fact, we go all the way to follow up with patients in the community. They take the medication at the facility. We ensure that we attach a treatment supporter to them, so that they will comply with the medication and complete the management. Because for any untreated symptomatic case, in a year, that single case can transmit infection to up to 15 people yearly, not even like in a lifetime. So you can imagine if we have 10 people left untreated, they
multiply effect.
Yes, it is a lot, and we are talking about eliminating TB come 2035. So we want to try as much as possible to break that chain of transmission.
Doctor, what are the recent advancements that have been made in TB treatment, and especially medication and in the area of medication and diagnosis?
Diagnosis. Okay. For the, in like in the 19th century, even earlier 20th century, you see that the major way of diagnosing tuberculosis is through AFB, using microscopy to check for mycobacterium bacilli. But we have moved past that, even though we use AFB to still do follow-up on test results. But for diagnosis, we now use GeneSPAT, which uses a PCR technology. Even beyond the GeneSPAT, there are other diagnostic machine that's introduced into the country now. We have the TB lamp, which also does the same thing as a GeneSPAT does, except for the fact that it cannot identify a reef resistant sample. So we have LF lamp that we use in HIV positive cases to detect bacterial organism, and then we use it to diagnose TB.
Some of these your grandma are getting. I hope the audience at home will learn a lot from my doctor. But there is something I want before we go for today. There's what are the drug resistant TB? There are some of them that are so resistant to drug. What are those TB that are drug resistant to doctor?
Okay, so drug resistant TB means that, just like the name implies, it is not responding to conventional
drugs. Treatment.
The first line medication that you use to treat a drug susceptible TB. So they tag them as drug resistant. And drug resistant can be multi-drug resistant, it can be mono-drug resistant, it can be extensive drug resistant. And when it is mono, that means it's just resistant to one of the first line drug. When it is multi-drug, that means it's resistant to either rifampicin and isoniazid. So that's multi. Then for the extensive, it means it's resistant to like these two and fluoroquinolone. Those are just terminologies for the clinicians, but we know that any patient that is tagged a drug resistant patient means that the patient is resistant to the first line medications that you want to use for a drug susceptible TB patient.
Thank you so much, Dr. Fatima Lawan, for this beautiful presentation. We are very grateful for your patience and your presence. We hope the next time we will invite you for other areas. We welcome our invitation, and we hope that our listeners, viewers at home, must have gained one thing or the other from this presentation, that we don't have to keep ourselves at home. We have to reach out to the medical personnel so that it will be diagnosed. It will be diagnosed on time, and so the risk of having loss of life will not be there. Thank you so much. This program, inshallah, as we start now, we will have different other guests, and even Dr. Fatima will be invited again, because I introduced her as the manager in Kwara, not only on TB, also on leprosy and even ulcer. So today we are dealing with tuberculosis, and definitely she will be around some other time to enlighten us on leprosy and really ulcer. Thank you so much, Dr. Fatima.
Thank you.
We thank our viewers for today's, and inshallah next time we'll be coming your way. We say assalamu alaikum wa rahmatullahi wa barakatuh.